Alright guys, hi, this is Doc ID. I am here for my second presentation that I'm going to do. This presentation is a little bit more of some questions we got from our first presentation regarding coronavirus. These are some really good questions we got, and I urge you guys to send out more questions that we can answer. Unfortunately, there's just a lot of confusion about coronavirus. There's not many recommendations. There are a few guidelines, there are no guidelines, but since it's a new novel disease, obviously as we get more answers, we'll get more guidelines as well. But from what we know what the disease does, we can try to answer some of these questions as to how we as infectious disease doctors tend to work with them in real life basis in the hospital as well. So I'm going to go with some of the questions I got from my first lecture. And the first question was, is asthma considered a comorbidity for COVID-19? That was the first question. Second question was, are masks necessary and why? Third question, CDC recommends N95 masks for healthcare workers when social distance isn't possible. If N95 not available, what are our alternatives? Question number 4, is washing hands frequently and continuous sanitization have a risk of decreasing our own immunity? And then the fifth question that we had was any guidelines for institutes that actually manage autistic kids that do not want to wear the masks, and it becomes very tough for the healthcare worker managing these kids. So these are some very good questions we got, and I'm going to start addressing them one by one. So we'll go to our first question. Is asthma considered a comorbidity for COVID-19? So I'm going to talk a little bit about asthma as to how it is actually defined, and then we can try to go from there to see if it is a comorbidity or not. So the Global Initiative for Asthma defines asthma as follows. Asthma is a heterogeneous disease, usually characterized by chronic airway inflammation. It is defined by the history of respiratory symptoms such as wheezes, shortness of breath, chest tightness, and cough that vary over time and in intensity. The Expert Panel 3 of the National Asthma Education and Prevention Program defines it as a common chronic disorder of the airways that is complex and characterized by variable and recurring symptoms: airflow obstruction, bronchial hyperresponsiveness, and an underlying inflammation. The interaction of these features of asthma determines the clinical manifestations and severity of asthma and the response to treatment. So, hearing these definitions, it is a chronic inflammation of the lungs, and COVID-19, one of the comorbidities for that is chronic lung disease. So in my opinion, if you do have asthma, which is always usually combined with COPD as well, there's always an overlap that we see, then it is, in my opinion, considered a comorbidity. But then again, I don't think just asthma alone is something that we need to be concerned about. Usually what we see in the hospital are people with 2 to 4 to 6 comorbidities together that kind of react poorly to coronavirus versus someone who probably just has asthma. But once again, very hard to say. More studies, when they come out, will probably clarify those questions. So I hope I answered that question for you. Alright guys, so now we come to question number 2, which was, are masks necessary? Well, the answer to that question is, in my professional opinion, is there are certain places that I feel that they are necessary, and then in certain places I don't think they are necessary. So I'm gonna kind of give you a little bit of a few examples as to when you see when should we wear masks and when should we not wear masks. All right, so I'll give you an example here. So most of us see sometimes people going out here driving with their gloves on in the car as well as a mask on in the car. So is the mask necessary at this point? No, it's not really. Actually, you don't even need the gloves as well. So when you're in your own car driving, in my professional opinion, you do not need a gloves on in the car as well as the mask. Now, when you're driving like this is fine actually. So you don't need any gloves in the car or your mask in the car. Now, however, if there's a passenger in the car and is not your sibling, then I would advise you to wear a mask in the car. Otherwise, actually, I would advise both of the passenger and the driver to wear masks if they don't know each other. But if you're on with your siblings, usually, since you're living in the house together, your risk is going to be about the same whether you wear the mask or not. All right, guys, so this is the proper way of walking. You really don't need, in my opinion, to have a mask on outdoors when you're walking the dog or you're just taking a stroll out when there are really no people around. So now here, in my opinion, when you're walking outdoors and you're wearing a mask, that is actually unnecessary. So that's not a way to, you don't need your mask, because that your risk of getting coronavirus is practically zero as it comes if you're just walking by yourself. So you really don't need to have a mask when you're walking outdoors and there's nobody around you. Now, this is a situation where you might come across and you're meeting a friend outdoors and you're both walking. Now, if you're that close, then I would advise you to kind of wear a mask, as you're kind of less than 3 feet together. But if you're at that point, either put your masks on or you could just kind of move apart a little bit, especially if you're outdoors. Now, indoors is a little different story. Once again, if you're family members, I don't think it's going to be a big deal. But if you're meeting strangers, then try not to be as close and move back a little bit. Dogs are okay. All right, guys. So I'm going to go on to question number 3. It says CDC recommends N95 masks for healthcare workers when social distance isn't possible. If N95 not available, what are our alternatives? So this question, let me kind of talk a little bit about it. I think CDC recommends N95 masks for healthcare workers actually working with suspected or actual positive coronavirus patients. There were guidelines between WHO as well as the CDC. They differ a little bit. CDC says that if you are managing a person who does have the actual coronavirus 19, to preferably wear a N95 mask, respirator, or a surgical mask. Whereas WHO is a little different. They say that a surgical mask is more than sufficient to wear, and you really don't need it. Obviously, there are some differences. You definitely need an N95 mask if it's more what we call a aerosol generating procedures, and that can be from a patient being intubated or having bronchoscopies and etc., stuff like that. So I'm going to show you what a true N95 mask is. This is a true N95 mask. You can see it's a 3M. This is the one that we wear in the hospitals. It actually has a lot number that you can see, and this you can check with the. So this is an FDA approved N95 mask is what it is. So we usually go through fit testing for this kind of mask. It's the difference, which I'll explain a little bit now. At the same token, I'm going to show you the masks that were also out there, since there was a shortage of these true N95 masks, even for us healthcare workers. A lot of people started buying is what we call the KN95 masks. A little different. It's you can see the inside's a little different from compared to this one right here. And I'll show you the difference as to what the difference is between these two masks themselves. And then the third mask is what we have here, is the surgical mask that we have. So with the surgical mask, we have a KN95 mask, and then we also have the true N95 masks, is what it is. So the question really recommends what do we do. So really, we actually see these coronavirus patients. We always, when we go in those rooms, do prefer to wear the N95 mask. Now, if there was a complete shortage and we didn't have any N95 masks, then you could wear your KN95 mask as well as the surgical mask that you have. The difference is in between the true N95 masks and these other two masks is that when we wear it, we usually fit test when we wear these masks. So that's a little hard. So we wear this mask and we get fit tested. When we get fit tested with this mask, it's a little harder to breathe inside. I'll tell you one thing, you wear this mask for 15-20 minutes, it does get pretty hard to breathe. So really no air should go out and no air should come out from your sides. You should not be able to smell anything, or literally all you should be able to hear is just the smell of the inside of your N95 mask, and that's really it. So you can see my glasses, they don't fog up when I exhale out, and that's what a true N95 mask is, to prevent anything from coming in or going out. Then we can come on to the KN95 mask, which in my opinion is not so bad. It's still better if you don't have a N95 mask. This is your second alternative, is what I would kind of preferably use in my opinion. So you can see how my glasses fogged up as soon as I even just took a little exhale, and you can see it again. So not as well fitted and true N95 as the N95, but then again, it is a great alternative if you don't have KN95 mask. Now again, this is for patients who are actually positive, or people who are actually positive for coronavirus, confirmed, and you are going to be interacting them with very close range, then yes, maybe you want to wear that. If you don't have access to this, then a KN95 is a good alternative, as well as even a surgical mask, which to me is like the number 3 down the line compared to everything. So I think you'll be well protected by wearing any of these masks. So I hope I answered that question. That if N95 not available, try to get a KN95 or even a surgical mask, and you should be fine with your kids, in my opinion. Now we go on to question number 4. As you can see in the slide, it says, is washing hands frequently and continuous sanitization have a risk of decreasing our own immunity? Well, in my opinion, again, we as physicians in the hospital do this on a continuous basis from literally morning to evening till we completely see all our patients. And there are sometimes patients that we see anywhere from 20 to 35 people a day. And then especially in the rooms that we go into, our protocol really is anybody who's on contact precautions, which I will talk about in another lecture as to what are the different type of isolation procedures that we do in general. We are supposed to, as physicians, and anybody who is going in to take care of patients should really foam in, is what we call. That's adding the sanitizer to your hand. Go in. If the patient is on contact precautions, then we wear a gown, gloves, and then when we take them off after seeing the patient, we once again sanitize our hands again, and so forth. If the next patient again is in isolation, we do the same process. So there's up to my knowledge, there is really no data that shows washing your hands frequently and continuously will decrease your own immunity and that's just I haven't seen that from what I can answer this question to. So I wouldn't be worried about you losing your immunity over washing your hands. This is something we all just need to have clean hands anyways. And as people at home or out at work, I mean, really, you're not gonna be really sanitizing or washing your hands day and night compared to what we do every single day of our lives when we are in the hospital. So that's answer for question number 4. So now then we come to question number 5. Any guidelines for institutes that manage autistic kids? So that's a very good question. That is from this friend of mine who runs autistic centers, and her concern was that with the kids not wanting to wear masks, it becomes a little challenging because with coronavirus, there can be asymptomatic carriers. If you're at your business, obviously you want to protect that, and then you won't really know as to whether the kids are bringing coronavirus to your center from home or actually picking up coronavirus from your center and taking it back. So it becomes a little challenging as far as that. And I think, in my opinion, I mean, there's just things that the center will have to establish with a infectious disease doctor or infection control people who run kind of hospitals to set something up, particularly for this kind of an institute. I'll gladly talk to you about that, as we will be also discussing a lot of infection control measures as well, to educate the people. All right, guys, so that's the end of this lecture today. We went over these 5 questions. They were really good questions that were brought up. I would encourage more people to kind of bring up these kind of questions or concerns that they have about coronavirus, and I can kind of answer them to the best of my knowledge. Once again, these are my opinions from my practice as to how to kind of control what's going on in the world these days. We are heading ways. There are a lot of studies being done, so we are progressing. So I know it's going to take time. I know people want to get out of this just as much as anybody else. So our next lecture, I might talk about isolation practices that we practice in the hospital, and that will kind of tell you a little bit as to what aerosol, how we as physicians practice that in the hospital. And I think that's what you should kind of be gearing towards, and trying to put some answers together about coronavirus, how to protect yourself, how to protect others in doing all of this. So till then, I'll see you next time. Doc ID.